In managing an individual who has rheumatoid arthritis, there's lots of pieces to it. And the emphasis is usually on what medication you're taking. Oftentimes, a rheumatologist feels that their job may be finished after I've made a diagnosis and written a script, but that's really just the beginning of that journey. In our example in Newmarket, where we have a very robust model of care, in that category we have individuals, health providers that include physiotherapists, occupational therapists, pharmacists, social workers at times, dietitians at times. The specific discipline is not as important as the deep knowledge of the person they're dealing with in the sense of the disease and what we can expect. So in our success has been a shared message that supports the person who oftentimes, especially at the beginning of their illness, has lost hope, has fear galore, does not know how to cope with an illness that doesn't go away, that they can't wish away or eat away or diet away or fight away. It requires a concerted effort to know that someone has their back. So who's required? The people that are around you that understand. We've done in our program in Newmarket something which is, shared care, co-competencies. So anyone of our team, whether it's the physician, physio, OT, even our pharmacists now can do intakes. That is, say, assess a person. We then go back to the individual who's the physio or the OT or the pharmacist for the exercises or the splints or the discussion regarding medication. With that is also one chart. There's not a physio chart and an OT chart and a pharmacist chart. There's one chart, and that's shared with the physician. And now with our new program, the Center of Arthritis Excellence, we actually share the same database. Splints can be intrusive on your life, changing your diet. So we have to blend it and find out that piece that doesn't substitute the intrusiveness of the disease with intrusiveness of therapy. And when you have this shared care, each of us is doing that. What do you need today? So if the therapist, the occupational therapist, while they're making a splint, as a for instance, saying, "How you doing, Jack?" And I'm having trouble with my medication. "Oh, can you tell me more about that?" This is the OT, right? "Oh, so you're having a problem taking your medication. Do you mind if we bring our pharmacist in?" At that moment kind of thing, at that sitting, not, "We'll make an appointment later on for you to see that person."